Well, I think, we're just after 7 Eastern time for Canadian, so I think we will get started. Okay, so first of all, I'd like to welcome everyone to this webinar on Cystic Fibrosis Canada's Meet the Experts, and it's on tips and tricks for exercise and cystic fibrosis. So welcome everyone. If you have a question, please put it in the chat box. Otherwise, what we're going to be doing is discussing the questions that have already been sent in prior to this meeting. And if we don't get to answer some questions, they will be put in a blog afterwards for people to see and to read about. So I'll introduce myself and then we'll pass it around to introduce our experts. So my name is Maggie McIlwaine, and I originally was a physiotherapist working at BC Children's Hospital with cystic fibrosis patients, and that's where I got all of my background in exercise and CF. I'm now the network manager for our cystic fibrosis clinical trials network. So changed jobs, but still love to work with CF. So I'll pass it over to Jane.
Okay, so Jane Schneiderman here. I'm an exercise physiologist and registered kinesiologist working at the Toronto Hospital for Sick Children. I work half-time for the Division of Respiratory Medicine, carrying out their clinical exercise testing, and the other half I work in clinical research services, running the Exercise Medicine Research Lab. The clinical lab is where patients with CF are scheduled to have their cardiopulmonary exercise test once a year with us, and the research lab is where we support a very broad range of clinical researchers who use exercise to understand the mechanisms of disease, including CF. I work closely with Blythe Owen, our very experienced physiotherapist in our CF clinic, with whom I collaborated on some of this material. So thank you to Blythe.
Okay, we'll pass it over to Nicki.
Hi, I'm Nicki. I'm almost 50 years old. I have cystic fibrosis and still have my own lungs, currently sitting at 27% lung function.
Wow, thank you, Nicki. And
I don't need
sorry,
Google
go ahead.
A lot more info.
Okay, over to Dr. Larry Lance.
Hi, good afternoon or good evening, wherever you are across the country. So I'm Larry Lance. I'm director of the Pediatric CF Clinic at the Montreal Children's Hospital, but I also, for the last 25 years or so, been a member of the lung transplant program at CHUM in Montreal, where I see cystic fibrosis patients regularly after they've had a transplant.
Okay, so thank you, Larry, for that, and for Nicki, and for Jane for those introductions. So the first question that we're going to ask is actually to Larry, and it is, why does he think exercise is so important for people with CF, and how does it help physiologically with CF?
All right, so first of all, physical activity is has an important impact on our exercise capacity. So those who are more physically active have a higher exercise capacity, and that's true for all of us. And similarly, for all of us, we know that exercise capacity, which is a marker of fitness, is a marker of longevity as well. So being active helps our overall physical fitness. Now, by being physically active, you'll improve your muscle function, you'll improve your heart function. These all will decrease the amount of work you have to do with your lungs for breathing when you're doing exercise. And we know very much so that if you train yourself, you can do more even if your lung function doesn't change. But we know that by being physically active, our respiratory secretions are a little looser and easier to cough up. I'm not saying that exercise is a replacement for physical therapy or airway clearance, but it is certainly a component of that. And actually, Jane and I did a study a few years back in children and teenagers where we showed that being more physically active helps maintain your lung function. For older patients who may be having problems with cholesterol or triglycerides. They can help maintain these levels in a normal range. And similarly, those with diabetes, it can be help in controlling our sugar levels. And similarly, those who have had a lung transplant will benefit from being more physically active.
Okay. All right. Thanks, Larry. And just going to head on with that, with asking Jane, what does she think are the benefits for exercise, especially in cystic fibrosis? And how does it relate to basically lung health and bone density, etc.?
So exercise with a huff or a cough improves mucus clearance, which is going to help us to improve lung function. And as Larry said, while it's not a replacement, we don't have any evidence to replace airway clearance. It certainly is an adjunct to ACT. And as he also mentioned, about in 2014, we had followed a group of patients with CF for over 9 years. And we found that those who were increasing their habitual physical activity actually saw a slower rate of decline in their FEV1. And what's important to stress there is it's not only exercise training that is necessary, but it's even habitual physical activity, activities that are carried out on a regular basis. So we know that exercise improves stamina, which strengthens the muscles, especially the breathing muscles and heart muscle. And we see that improved mood or mental health as a result of exercise becomes a positive cycle of improved mood, and patients are often commenting that they're better able to comply with their therapies in general. So when we get to bone density, we know that weight-bearing exercise can reduce the risk of low bone mineral density, fracture, osteoporosis, and these are things that people with CF can be prone to. Now, weight-bearing exercise can be low impact, such as just walking upstairs, or high impact, like high intensity interval training, aerobics, running, or playing sports with very jarring changes of direction. We do know that resistance training can maintain and improve bone density, and it's routinely recommended for people at risk for osteoporosis, such as patients with CF. And there was a consensus statement in 2005 that showed that people with CF, there was association with the hours of weight-bearing activity and bone mineral density similar to that in the general population.
Okay. All right. Thanks. So talking about that, we actually have Nicki with us, and Nicki has cystic fibrosis, as she's already mentioned, and she's going to tell us her experience with exercise.
So I've been exercising my whole life. I was not coddled as a baby. I was told to do anything and everything I wanted to do. So thankfully, it's been in my life since I was diagnosed, basically at 4. So I got into all the teams and became, a basketball star and a volleyball star and all that. And then went to university in 90. And then I caught Pseudomonas in 91 for the first time. And so my lung function started to go down. And I was losing airway clearance abilities, which used to just be my sports. And so I had to pivot, and I couldn't play basketball anymore. I couldn't do the volleyball. I couldn't do any curling, all the stuff I love to do. And so I picked up weight training. And then I've always either done walking or rowing or biking every day of my whole life, no matter how I feel. So to me, that's been my biggest way to keep my lungs as clear as possible and as strong as possible. So it's a game changer for me. And I know a lot of people absolutely hate exercise. And I will tell you, I can get you into working out by the time we get to the end of this talk. And my bone density, by the way, is better than women of my age that don't have CF.
Fantastic.
So you can see how the weights and the training are helping me personally.
That's great, Nicki. Great. So I've been asked to talk about some of the practical ways that we can include exercises in our daily routine without making it a chore. And certainly, Nicki, you have certainly integrated it into your daily life. But I know from being a physiotherapist, I mean, we always push people to exercise, but we don't want it to become a chore, such as, you know, they're doing 2 hours of airway clearance and inhalations, and then we're asking them to do another hour of exercise. So a better way is to try and look at what you like doing, look at how you can make exercise integrated into your life. So for instance, if you're a parent taking your child to school, can they walk to school? Can they ride their bicycle? A child in school, I mean, can they going to the gym class or going to the playground after school is another way of doing it. Taking the stairs, one thing is I always push is stairs instead of taking the lift if you're anywhere, or instead of using an escalator. Again, anywhere where you're getting your heart rate up and you're getting a bit short of breath, that's really good exercise for you. So I mean, swimming, joining a sports group like Nicki was very much involved in sports group, and certainly we try and get our kids involved, and we say to the parents, pick a sport that your child is interested in and try and get them more involved in it. So whether it's playing hockey or whether it's soccer or swimming, anything that they can get their child involved in sports is great. Okay, so that was the first round of questions where we're looking at the important benefits and overview of exercise in CF. And just for our audience, if you have any questions, you can just put them into the chat box. And as I said, we will get to them. But we're going to move on to the next part of our questions that were sent to us were recommendations and practical tips for exercising. So one question for Dr. Larry Lance is, what amount of exercise should a person with CF need, and at what intensity?
Okay, well, Maggie, you said half the things I was going to say.
That's okay.
And I think it's really important. You know, this should be enjoyable. This should not be work. This should not be another therapy. Speak with your CF team. They can help you figure out, you know, what type of activities you would want to do. Doing with, you know, friends or family or a team is an excellent way. It's a great way to keep yourself motivated. But getting into the nitty-gritty, how much exercise? So the official recommendations for children is 60 minutes a day, 5 days a week, of what we call moderate to vigorous activity. And I'll explain what that means in a second. But you should also, especially for children, include flexibility, activities that make you improve your flexibility and your coordination, like throwing a ball, etc., all those type of things. And for adults, we talk about 150 minutes a week, when you can do it in short bouts, but a bout should be of at least 10 minutes. Now, when we say moderate activities, it means you should be breathing hard and your heart rate up, but you should be able to talk while you're doing it. Whereas a vigorous activity, but not be able to sing. So it's got to be enough that you can talk but not sing. Whereas vigorous, you should be really talking in short sentences. So those are sort of the guides, but really do a mix of things you like to do, and switch it up because otherwise it becomes very routine and drudgery.
Yeah. It's good that we're all on the same line of thinking, Larry. So we're all giving our people with CF, we're telling them the same things, which I think is important to hear. And so back to you, Jane. We talked a little bit about lung health, but is it just the cardio, or is muscle building important, or what about posture?
So let me just set my timer here because I know I've only got 2 minutes.
Used
Right.
up 30 seconds, Jane, already.
Exactly. There you go. So people say, should I be doing cardio? Should I be building muscle? Should I be, looking at posture improving exercises? The answer is all three. And really, cardio gets all the attention. Whereas high intensity interval training is getting a lot more attention lately. It has the potential effects on secretion clearance. It has potential effects of strengthening the diaphragm to engage which is the main muscle of respiration. And again, Swisher et al. In 2015 recommended resistance training or weight training for child, adolescent, adult, everyone with CF. For people with severe lung disease, resistance training may actually be the optimal mode of exercise because there's a lower ventilatory demand than with continuous aerobic exercise. So really working all three is very important. So what about posture training? Well, changes such as forward head, thoracic kyphosis, protracted scapula, elevated shoulders, all these are going to change rib cage mechanics. And they're going to limit lung capacities and how efficient our muscles work together in breathing. This can lead to pain, malalignment that can lead to fractures when there's decreased bone density. So postural muscles, meaning the core, deep spinal extensors, pelvic floor and the diaphragm. These are all what we call the postural muscles. And there's all kinds of exercises that you can find on the internet or through your physiotherapist that can target those postural muscles. Things like cat-cow, the doorway stretch where you put your arms up in front of the doorway and trying to stretch across the chest. There's chin tucks, which are very easy to do where you're sitting. You can be doing anywhere, just even on the phone, you can be pulling your chin back. Standing and pulling apart a band in front to strengthen those muscles in the back between the scapula. Stretching the hip flexors down on one knee. Bird dog is very well known. Half cobra, where you're lying down and lift the top half of your body. So really, posture training is critically important.
Okay, thank you, Jane. So what you're saying is yoga is great for our patients.
Correct.
Yes.
Correct.
Which is great. Yeah, there has been actually some studies that have shown that upper body exercises have been associated with increased lung function. And as we all know, I mean, with the posture, I mean, bodies, because of the mechanics of breathing through secretions, it alters your whole your posture, as Jane mentioned. So thus, I mean, it's important that we do try and keep thoracic mobility, which is important. So some of my, I've been asked to talk is about, one of the questions we got is there organized activities for CF kids, and what should they do and what should they not do? So I'm going to try and share my screen and answer a couple of these questions together. So when we have somebody diagnosed with CF, we try and have them. When we talk to the parents, if it's a baby, we talk right away. We introduce the idea of exercise. And I think this is really important, that because you want to make it part of their life. Now, as a baby, don't forget, baby has only limited lung function because their lungs are not fully developed, and their lung develops sort of way in line with the development of a baby's motor skills. So as the baby, starts to crawl, as the baby then starts to walk, so our lungs are developing as well. So we usually say for babies, and one of the questions I've just come up to in the chat room is, can I take my baby, what do we think of swimming pools for a 10-week-old or a baby, I think it was. So certainly swimming pools are great. There has been an association of swimming pools and Pseudomonas acquisition. But has been more with hot tubs, and where you're getting where there is greater heat, and it's Pseudomonas has been found to be around the edges of the hot tubs. But if you're in a local swimming pool, it should be fine because they control for the bacteria and they control the temperature, etc. So certainly the benefits of swimming outweighs any of the harm that it can do. So for toddlers, this is just a slide picture of one of the pamphlets we give to our patients for toddlers to do, and play, very much play activities with kids, whether it's riding your tricycle, and upper arm exercises is great. So whether you're doing wheelbarrow over a ball, just being swung around, or reaching up, all of these activities are great for toddlers. Bouncing on something is super as well. Just getting that motion up and down, blowing bubbles, any of that is super. In some centers, what they actually do, they have the patient and the parent picking out something from a bucket, one program a day that they may do. And it could be something even like skipping, or just a game that they play, like hide and seek, where they're running and getting short of breath. But just one of the examples that I've come across. We're going to talk about exercise as an opportunity later on. When the kids get older, trampoline has been brought up. Is that a good exercise for kids? And certainly we all know about the pitfalls with the trampoline, but there was a study done looking at the effects of trampoline in people with CF, and they found that it outweighed the benefits of using a trampoline, outweighed the other aspect, the risk aspects, especially if you're using it within all the safety parameters. And certainly you can have around the trampoline now, you can put up those mesh wires. So that is great. Another question just associated was that, is there any type of exercise that we should, our kids should avoid? And one of the things certainly is we've talked a little bit about avoiding horseback riding. Horsebacking gives you a bounce, which is great, but there's also been some association with cleaning out the barns where the horse may be and turning over the hay with that, and aspergillus. So that's certainly one of the things that we avoid our patients, ask them right from the beginning to avoid with the horses. Okay, so I'm just going to stop here and see if there's any other questions out there. Okay, any other questions? Okay, not at the moment. Okay, because we're going to go on to then our next set of questions is looking at financial support, and what about the cost of going to gyms? Are there any other recommendations that we can give them? And so for Jane, are there supports or grants available to help cover the cost of equipment or gear that people may need?
So this was a really interesting one to do some research into, and I found something quite interesting. The CF Lifestyle Foundation, which is actually a US foundation, has a particular application for Canadians. And it is open to Canadians, requires health information. It is patient initiated, but it will be a grant to help offset costs of things like equipment, programs, and so on, I believe. Worth looking into. CF Yogi, free online, taught by instructors that are also including people and caregivers with CF. It was originally a US grant, and there are individuals who are trying to get it renewed now to keep it going. The YMCA used to have a free 1-week trial, obviously pre-COVID, not sure how that's working out right now, but worth looking into. Really helpful to look at an individual community center nearby wherever you live to see if there's free programming. And of course, during COVID, the amount of free online programming has just exploded to many, many different options. So that's something to look into. And the last one that I bumped into, which was really interesting, is it's something called Beam, an online exercise platform for people with CF. They offer live and on-demand exercise classes, including motivational and community support. There's a whole variety of exercise classes supporting people at all stages, led by either specialist instructors who either live with or work with CF. So that's what I found.
All right, just to add a little bit about the Beam, we have been in touch with the Beam instructors, CF Canada, and they do charge quite a bit of money, and it was something that we certainly, CF Canada certainly did not think that we could pay for patients. Having said that, the trust in the UK is supporting this for their patients with CF. But it's something.
Was there not one little thing somewhere that said you could apply to have it covered, or you could there was some opportunity to apply to have coverage?
They give you a 30-day free.
Okay.
That's
okay.
it. Yeah.
Okay.
Yeah. So certainly it is there if people want to look it up. And
okay.
Any feedback on it would be very helpful. Okay. So then for Nicki, what advice would you have for anyone with CF looking to attend a CrossFit gym?
Okay, so I didn't get into CrossFit last time, and I should have. CrossFit, I fell in love with in 2013, so it's been 9 years. I actually opened my own gym. For 5 years, I had to close it because of COVID. Now, it was developed to enhance an individual's competency in performing all physical tasks. So whether it be bringing in groceries from the car or going for a hike, it's considered functional fitness, meaning it trains you to do everyday functions like squatting down to pick up your child or holding on the leash of a hyper dog, or to simply get up and out of bed safely. The modality behind CrossFit is that it trains you to be better at life. So I joined, I was freaked out. I didn't want to have to explain myself, but I knew I would have to because CrossFit has the reputation of being an elite fitness methodology. I found out that it is not. It is made for every body and every type. So every workout can be scaled to your abilities. So if they're doing, push-ups and pull-ups and something more difficult, they'll actually scale it down. Like, for example, push-ups you'll do against the wall, and pull-ups you'll do ring rows. So things that you can manage even with bad lung function. I've got bad lung function. So I've done amazing things. I've gotten to the point where I can do a handstand walk, and survive. So the thing that I would say that if you're going to join a CrossFit gym is be honest, meet with the manager, let them know how you are, what your limitations are, what you can and cannot do. And when you go to your first class, the coach will adapt the workout of the day, the WOD, to your abilities. But the beauty of it is you feel like you're a part of the class. You feel like you also are an athlete. You're doing all the same things in your way, and it's good for you in boosting your confidence. And the other beautiful thing about CrossFit is that you write down all your workouts so you can track and measure your success and the increase in your strength. So that's why I'm in love with CrossFit. And I've done lots of programming for lots of CF patients that they can do it at home.
So if anyone wants to get into CrossFit, where would you advise them to look?
Just Google CrossFit and locations near me. There's usually, Calgary's got like 10 gyms. Toronto probably has 30. But you can also, it's, I know a lot of people are intimidated and they probably will not do this. So basically I'll send you guys, whoever wants one, I'll send you a week's worth of programming that requires no equipment. And you can see if you like it. See if you like the different workouts. It's all different workouts. You never do the same one over unless we're doing testing to see how much you've improved. So I'm happy to do that and get you started.
Okay, thank you, Nicki. Thanks for that. We're going to move on now to look at some of the complexities of exercise and some of complex conditions with cystic fibrosis. And the first thing we're going to look at is with Larry. And can he, what exercise would you recommend to people with CF-related diabetes or CF-related arthritis?
Okay, so for people with diabetes, really there's no restrictions on what types of exercise, but I have to realize that when you exercise, your cells take up your sugar more. So your risk for having hypoglycemia or low blood sugar events. And so you probably have to adjust your short acting, and you very well might have to adjust your long acting insulin. I had one of my patients after transplant who got into vigorous exercise. And every 3 days, we were on the phone and I was adjusting her insulin downwards because her level of activities was never what it had been ever before. And she's benefiting from it, but we had to adjust things. And as she backs off her program, then we have to readjust her insulin again. You also have to make sure that you have some sort of source of short-acting sugars, fruit drinks, or whether it's Gatorade or something like that, just in case you have it, because we know that cystic fibrosis patients, their bodies don't necessarily produce glucagon, which is a sort of anti-insulin and helps raise your blood sugar. And so you want to avoid, hypoglycemic episodes because they are really unpleasant. For arthritis, it depends. You certainly want to discuss this with your clinic's physiotherapist. There might be certain exercises if you have, upper joint, let's say shoulder arthritis, something like that, that require different types of exercise or modified type of exercises. If you have lower limb arthritis, let's say your knees or something, doing activities that don't require as much weight bearing, like doing sports in a pool where there's the buoyancy helps hold you up and decreases the stress and strain in your knees, will be a lot better. Biking will be better tolerated, let's say, than jogging or running, which is on the pavement and all that. So you do want to definitely listen to your body and adjust your exercises so that your joints don't pay the price.
And what about if we know that our patients quite often they can have a respiratory exacerbation, they may or may not end up in hospital, but at that time they don't feel like exercise. How would you or what would be your advice to patients both during an respiratory exacerbation and after they're just starting to get over it?
Okay, so actually, when we hospitalize our patients, we do an exercise program. If they can't leave their room, then we bring the equipment to them. We have a bike typically brought in the room. We have mats. We have weights. Or if they're able, we'll bring them down to the physio gym. So an exacerbation is not necessarily a reason to back off. And actually, there's good evidence that people make a better or faster recovery if they're physically active during exacerbation. You can lose a lot by lying in bed for 3 to 5 days, and that's for all of us. Now, if you're having a flu-like illness, having fevers and muscle aches, if your muscles are aching, it means their muscles are inflamed. That is not the time to be doing vigorous exercise of those muscles because you can actually injure those muscles. But most of us, or most patients, when they have an exacerbation, they're not really having those fevers or joint pains or stuff like that. And so, like I said, they are able to work out. Obviously, if you're having more trouble breathing, maybe your regular routine will not be as well tolerated, so you'll want to back off. That's where I'm saying, when I said moderate to vigorous activity, it's all based on how you're feeling. If you're able to do it and you're breathing okay, then it's okay. Actually, it was very funny. On the weekend, we had one of our teenagers in, and he tends to be, mostly a video game player. And the physio, who's actually quite physically active herself, said, "Let's go take a walk up the stairs." So they walked up 4 flights of stairs, and she was huffing and puffing, and the patient was going like, "Yeah," and so. So I said, "Okay, you're doing okay." So you have to adjust things for your tolerance.
Thanks, Larry, for that. And Jane, do you have any comments, or maybe we'll ask Nicki as well, about exercising with a Picc Line in, or if you've got a venous access device in? Would you like to start?
I thought I'd just give a couple of quick items, and Nicki, maybe let you take over. Just obviously, a Picc Line could be in for quite a while. So during having that Picc Line, there are some contraindications, such as not lifting heavy objects with that arm that has the Picc Line, no playing contact sports. Swimming is not appropriate. Not repetitive movements using that upper arm vigorously, such as vacuuming, raking, golfing, and so on. But light to moderate activities, walking, running, yoga, and so on, are encouraged. Nicki, what's your experience been with your Picc Line in?
Yeah, so with my Picc Line, I've done all of my workouts, just modified them.
Right.
I think for us, the most important thing to do is to make sure the Picc doesn't move. It's not if it gets hit or whacked or something, it's if it moves. And luckily, they do stitching with ours now so that it's almost impossible to shift that line, which is great, which means you can be a little more aggressive with your workouts. I've done, like, I'm not doing 20-pound bench curls. I'll drop it down to 5 pounds on that arm, but keep the other arm going with that, with the higher weight. So it's just a matter of just being smart. I mean, I can hang from the bar with a Picc Line in, that's not a problem. And I can row with a Picc Line in, that's not a problem. Bike with it, like the stationary bike. So there's a lot of things I managed to do. There really isn't anything I can't do with the Picc Line in.
Excellent. Thank you for that firsthand experience.
You bet.
So the ventricular assistive device, sternal precautions for the first 6 weeks, no contact sports, make sure to have a good warm up and cool down, and really using a rating of perceived exertion to monitor intensity, because you can't look at blood pressure or heart rate with that device. Proceed very slowly and evaluate tolerance every step of the way. Another big issue is avoiding abrupt postural changes, because blood flow is being assisted by this device. But what's recommended is low to moderate intensity, dynamic, large muscle group activities, walking, stationary cycling, not cycling outside, and exercise involving upper body muscles.
Okay, super. And Jane, just while we have you, is there any exercise you would recommend for people with musculoskeletal injuries or low bone density?
So, first of all, if you've got the bone density or fractures, you want to really avoid spinal flexion or twisting during the exercises. You want to avoid fast, jerky movements and use very slow, controlled movements. People with vertebral fractures can exercise up to an equivalent to a brisk walk. So according to Larry's description, that would probably be moderate activity as opposed to vigorous. People at risk for falls, you want to really target strength and balance training, and really working with your physiotherapist to modify the activities, ideally to encourage return to normal activities, but all within the confines of where the fracture is and the degree of fracture. But anyone who can, everyone with osteoporosis can benefit from guidance on adapting these postures. So free weights, resistance bands, using their body weight, stretching, but all under the guidance of your clinician.
Okay. And Larry, what about CF lung transplant? Some of these medications, how do they affect your energy level and muscle function? Things like prednisone affecting your tendons or joint pain?
Sure. First, let me say, and I say this to all my patients after transplant. I said, you're starting to use muscles you haven't probably used for quite a while, so you want to start slow. I tell people, well, I want you to push yourself. You also have to listen to your body. So when it's time to rest. I'm a very big fan of flexibility and mobility. As I tell people, your new lungs and your old chest are a new couple, and they have to learn to start to work together. So doing breathing exercises. Jane mentioned earlier on that with lung disease, you can get a change in the shape of your chest. And now you've got new lungs there, and they're going to be, not all hyperinflated or not, don't have fibrosis in them. and it will change the shape of your chest. And so your muscles, especially your spinal muscles, have to realign. And it takes work doing that. Now, sure, we know that steroids can cause ligament stretching. We know certainly if you're on an antibiotic, ciprofloxacin, there's a risk of tendon rupture. So you have to be careful if you're taking ciprofloxacin. And I'll bet you many of you have taken ciprofloxacin who haven't had a transplant. So again, you sort of have to listen. I had one of my patients who was a major bodybuilder, and he said, I was doing this with 40 pounds and it hurt. I said, yeah, no kidding. So you do have to balance it out. Many patients, due to the multiple medications after transplant, do have a certain sense of fatigue. I have to write to many insurance companies about this, explaining, no, it's not their FEV1. They're fatigued. It's a real thing. And that's why I'm saying I think people have to sort of listen to their body. We know also the skin will be a little thinner, so people bruise a little easier. This is sort of all part and parcel. But I've had a lot of patients do all the things they love to do afterwards. They've participated in transplant games. I have one of my patients who many years after her transplant started to get into bodybuilding. And now she is actually doing and weightlifting. She's doing competitive weightlifting competitions. And her videos were like, oh my God, I was just really amazed. So all these things are possible. Doesn't come overnight. You have to work up to it. I also tell all my patients who are waiting for transplant, this is the time to really get yourself in shape. The better shape you are going into your transplant, the faster your recovery. And people don't necessarily, I said, you need to almost do like Olympic style training. Your main job is to get yourself in shape so you get out of the hospital nice and fast afterwards.
Thanks. Okay, thank you, Larry. So we're just going to finish with a few other questions on other recommendations. Certainly, one of the questions I get asked all the time is, can exercise replace airway clearance? And so this is always a question that I get asked. So I'm just going to show you what we know and what we need more to study. So we know that when we're exercising while we're getting short of breath, we're increasing the volume of air that we breathe into our lungs. And this does help to loosen mucus. We're opening up some of those airways that have been closed off. However, it does not move the mucus up the airway. It loosens it. But having said that, some studies have shown that if we combine huffing, which is a forced expiratory maneuver, something is we're going to breathe out really fast with exercise, it can actually, exercise can be as effective as an airway clearance technique. But the type of exercise is important, and so it would need to be some type of interval aerobic type training exercise, and an exercise where you're going to be stuffing and huffing every 4 to 5 minutes. And I should say now that there are a few studies now going on looking at this, can exercise replace airway clearance. I wouldn't recommend anybody to stop their airway clearance just right at the moment and replace it with exercise. Some people may want, who are doing exercise, rely on it more. I would advise them to certainly include the huffing as part of their exercise routine with that.
I just add in that I use my flutter with working out all the time.
Yes. Okay, great.
Best, absolute best.
Oh, super.
Yeah.
Okay, all right. Other question for back to Larry again, and Larry, I've only got 2 minutes in this one. What are the calorie needs for exercise regime? And I mean, what about dieting, electrolytes, salt consumption, etc.?
Okay, so if you're going to start doing regular figure activity, then obviously it takes more calories. And People have always been worried, oh, if I start exercising, I'm going to start losing. People who don't have CF, exercise doesn't necessarily result in weight loss very often because people compensate by eating more. Yeah, and same true for CF patients. There's no reason that an exercise program should cause you to lose weight. You have to match with the calories. Now, we know cystic fibrosis patients need higher protein. If you think about it, mucus, which people are coughing up every day, is really a protein that you either spit out or you swallow and it goes in your poop. So you're busy producing protein and throwing it away every day, so you need more protein. And especially if you want to build muscle, you're going to need more protein. So people need gram and a half a day. You definitely want to hydrate. We know that cystic fibrosis patients tend to have a lower sense of thirst, so you sort of have to push yourself to drink. And you do have to replace your salt. So a cystic fibrosis patient, a typical cystic fibrosis patient, loses about 5 times the amount of salt as somebody who doesn't have CF in their sweat. They have a sweat test, you say 100. Well, somebody who doesn't have CF has a sweat of 20. So that's someone with CF is losing 5 times the amount. Now, that amount of salt is not going to be so necessary for those who are going to be going on the new triple modulators, which everyone knows is Trikafta, because we know that Trikafta significantly will improve your sweat test. I'm not saying it's going to go down to 20, but it may very often go down to 30 or 40, so two times normal, or 2.5 times normal. So
mine went from 120 to 39.
Wow.
Right. Exactly. So we always used to push a lot of salt. You still need some salt replacement, whether you want to take it within some sort of sports drink, and it doesn't have to be an exotic or expensive sports drink, or if you want to take a salty snack with your hydration, that's fine as well.
Thanks. Nicki, you said you're nearly 50. So one of the questions came up was about the best exercise routines for people in 50 and older. I will just add, even without cystic fibrosis, I bought an electric bike this year and I can still exercise a lot with it. And so if you've got low lung function, certainly, or if you're older, I would certainly recommend electric bike as one way of exercising. I don't know what else you would like to add.
Well, I mean, I'm obviously doing CrossFit, but I have a rower. I have a rower. I have a gym in my house, so that not everybody can have that, but I do have a rower, and a rower is actually the best out of the stationary bikes, etc. The rower is the best that uses almost all of the muscles in the body. So I would, if you're going to get something stationary, get a rower. No offense to the bikers, it's just the rowing gives you a lot of different opportunities to get stronger. So but I do CrossFit, and it's just, again, all the workouts are meant to my level of fitness. So if you're 50 and you're arthritic and you're basically old, a CF old person, then your workouts just adjust. But you can still do, step ups. You can still do push-ups against the wall. You can do, there's a lot of things you can do with even just a set of 5-pound weights. I mean, I can set anybody up for the workout, anybody, to exercise well into your hundreds.
I mean, it's great now that we have to think about exercising and CF for the older adult. I think that's just so wonderful compared to years ago when we couldn't even think like this. So it's great. So last question is just going to Jane. Any final recommendations on age groups? We've talked about kids, we've talked about the older. What about like teenagers and adults? I'm thinking more of. Any final comments?
So CF Canada has put this lovely infographic on their website, and it talks all about exercise for the different age groups. And really, you'll see that it's has to do with maturity, and it has to do with tailoring the activity to the age of the kids. So, 1 to 6-year-olds, it's got to be play. Kids don't exercise, they play. It's got to be fun, or else it's a drag. It's got to involve family members because that's who they hang out with at that age. And the greater the range of activities, the better. CF or no CF, the key here is variety. It's also good stress relief. 7 to 12-year-olds, no reason not to start a bit of resistance training, anything that's using their body weight. And lots of aerobic activity, as Larry said, 30 to 60 minutes at least. Actually, no, you said 60 minutes of moderate to vigorous every day, but aerobic 30 to 60 at least 3 times a week. And you're trying to encourage normal motor development, or nowadays they call it physical literacy. So it's ball games, how to throw a ball, how to run in and out of cones, how to move your body around a soccer ball, and so on. And then when we move into the teens, well, we know that that has to involve friends. Kids of that age don't want to be doing exercise. They want to be hanging out with their friends. All the better if hanging out with their friends includes doing something that's moving their body. Also, the goal is 60 minutes a day of a variety of activity. It says, especially with family, chances are an 18-year-old does not want to be exercising with their family most often, but they definitely want to be doing it with friends. And resistance training can now be more formalized, and you'll see that in the school system, the fitness classes involve learning how to use a weight room, 13 to 18-year-olds. And then 19 plus, as Larry said, 150 minutes a week or more. And here you're looking at aerobic activity, resistance training. For some reason, I don't see flexibility and postural stuff here, but we know that that's very important. So really, we're looking at adapting the activity according to the different maturity level and the different needs of that age group.
Okay. All right. Thank you for that. Okay. So that brings us to the end of our question at the moment. But it has been recorded, and it will be available for people if they want to watch. But I want to thank each of you, Jane, Nicki, and Larry, for coming and giving this great talk, great overview on exercise. So thank you all very much. Good night. Good afternoon or good night. Bye.
With pleasure.
So long. Bye.
Bye.
Bye.